Today we're going to talk about the causes of low back pain, the anatomy of it, how pain arises, and some stretches you can do to help relieve the pain and stiffness. So please stay tuned. Now, low back pain can be caused by so many different kinds of things, but I'm going to be touching more on what I see more often and the more common causes of low back pain. So these include trauma from motor vehicle collisions, slip and falls, or sports related injury, or from repetitive motions, also from an increase in weight, such as lifting something heavy or bending over just to pick something up, or you can have it from twisting or turning, such as shoveling. Shoveling at this time of the year is a very common cause of low back pain. And lastly, weight gain. Weight gain is going to increase the weight to the disc and also increase the stress to the facet joints. And now all of these typically involve the joints, the muscles, the ligaments, and the disc. So acute pain tends to be more generalized as far as trying to locate where the pain is. So for example, if you were to have pain on your lower back, it might spread across your lower back. Now, if you were to have a chronic case of low back pain, you might be able to pinpoint exactly where the pain is more often than not. So we'll move on to the anatomy of the lower back. All right, so I'm going to talk briefly about the anatomy of the lower back. So first, I'm going to use this model. We have these vertebrae, right? So there's 5 of these vertebrae in the lower back, and in between each vertebrae is a disc. So these discs are called intervertebral discs, and they act as cushion between each of these vertebrae, and they also act as shock absorbers for weight that's being put down onto your lower back. Coming out of the side of the vertebrae of the spine here is these yellow things called the nerves. So these nerves, they go and they innervate your legs, your stomach, your bladder, your bowel system. So they allow all of those organs to work. Now, moving to the side view of this vertebrae, we have these right here. These are, if you ran your finger down your back, these are the bumps you would feel. This is the spinous process. These are the spinous processes. And laterally to them are the transverse processes, these projections that are coming out from the side here. So both of these act as muscle and ligament attachment sites. They allow the body to move fluidly throughout. And the last thing I want to touch on is the curve of the spine. So that's important because the curve of the spine allows the weight of the body to distribute evenly throughout the lower back. And then also it allows the lower back to absorb this load, this extra weight evenly as well too. Because if not, these discs they can degenerate sooner and can cause a lot of problems such as disc herniations. So and we'll go more into details next about the pain and how they arise on the lower back. All right, so I'm going to talk about mechanisms of injuries and how they can cause pain. So the first thing that can happen is you can have overstretching of the ligaments, and that's called a sprain. And then you can also have overstretching of the muscle, and that's called a strain. And then you can also have disc herniation or disc bulge. And usually when a disc herniation occurs, the fluid that's inside the disc comes out and it puts pressure onto the surrounding nerves. And that's where you're going to have that numbing, tingling sensation that runs down your legs and runs down your calves into your toes. And then the fourth thing that can happen is a misalignment of the joints. So the adjacent joints are not in alignment, so that that decreases the motion between them. And usually when you have a decrease in motion, the muscles surrounding it tends to tighten up and tends to spasm because the body doesn't know what to do. The body can't fix it, so it just tenses up to prevent further injury. So all these mechanisms of injury causes inflammation. Now, inflammation itself is not a bad thing, but too much of it is where you start having the issues. So inflammation, what it does is it releases chemicals to bring in fluid to start the healing process to get rid of the injured cells and replace them with new ones. So what happens is that when you have too much of it, it can put pressure onto the surrounding nerves, and it can also excite the pain nerve fibers, and that's where you can feel the pain. And these chemicals can also go into muscles and cause them to spasm. So that's where you can have that generalized pain that goes across the lower back. Now, with all these, you have to remember that the nerves and the muscle fibers are not the only things that are affected. These nerves, they also travel to your organs, such as your digestive system, your bowel, and your bladder. Now, those can all be affected to a varying degree. And so the next thing I'm going to talk about is treatment, as far as how you can help yourself at home to feel better, to decrease the pain, to improve your motion. Okay, so for self-treatment at home, what you want to first do is decrease the inflammation of the area on your lower back. And then you want to improve the mobility and then improve the strength. So to decrease the inflammation, what you want to do is ice the area. Ice the area 15-20 minutes the first couple of days after the injury. And then following that, you can start heating. So with mobility, I'm going to show you 3 stretches you can do to help improve the mobility. And then as far as strengthening, I'm not going to go over strengthening exercises here, but I do have a couple on my posture video, so you feel free to go back and look at that and take some of those exercises. So the first stretch is called the Piriformis Stretch. This one targets the piriformis, hence the name, which lies under the glute muscles. So this stretch you can do either seated or laying on the ground. So you want to start in a seated position with your leg crossed over your knee, as I'm doing in this video. I'm going to pull that knee towards your chest and not the other way around. You don't want to bend towards your knee here. And you're going to feel the stretch along your glute muscles, and you're going to hold that for about 20 to 30 seconds, and make sure you do this on both sides, 3 reps each. Now laying on the ground is going to give you a little bit more of a stretch, and you're going to start in the same position as you did while you were seated, but instead of pulling the knee that is crossed, you're going to pull the opposite leg. Now depending on your flexibility, you're going to either grab your hamstring or you're going to grab your shin, and you're going to pull it towards your chest. And this is the same. You're going to hold 20 to 30 seconds and do 3 reps of each side. So our next exercise is called the hip flexor stretch. And this one you can do it either on or off your knee. And this is going to target the quad muscles and the psoas muscles. So to start off with, you want to get into this position that I'm in. And also make sure that you have something stable to hold on to, such as a chair or a table. And then also make sure that your knee in front does not go past your toe, because if it does, you're putting a lot of stress into the knee. So to start off with this stretch, what you want to do is lean a little bit forward. And lean until you feel the stretch on your quadriceps. Once you feel that, you're just going to hold that for 15 to 20 seconds, and you're just going to repeat that on both sides, 3 reps each. What I'm also showing here is you can just rock back and forth as well too, just so you can kind of get the hang of it. But once you get more advanced, you might want to just lean into it. So the next level of this stretch is to get into a lunge position. Also remember to make sure that the front of your knees does not go beyond your toes. And then the next level beyond this is to raise your arm that's on the same side as the leg that's back and raise it towards the back of the wall. These are going to give you a much bigger stretch on your quad and your psoas muscle. And again, with these, it's 15 to 20 seconds each, and you're doing 3 reps on each side. So this last exercise is called the Camel Stretch. Now this exercise targets quite a bit of muscles, such as the erector spinae muscle along the lower back and the upper back, the gluteus maximus muscle, the latissimus dorsi muscle, the trapezius muscles, the rector abdominis muscle, and even the supraspinatus muscle. So to start off with, you want to be on all fours. Then you're going to raise your head and push your hips backwards, creating an arch on your lower back. This position is similar to a cat stretching, thus the name. Then you're going to bring your head and your pelvis towards each other, creating a rounding of your back, thus the name camel. And now with each of these positions, you only want to go to where it's comfortable for you, and don't force any of the range of motions. So you're going to hold each of these for about 5 to 10 seconds, depending on your level, and you're going to just do 10 to 15 reps, and that will complete the exercise. So thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.